Knee osteoarthritis. You've probably heard of it, right? It's one of the biggest reasons people have knee pain and stiffness. So in this explainer, we're going to break down exactly what it is, who it affects, and, most importantly, what you can actually do about it.
So let me ask you, do your knees ever ache when you're just walking around? Or maybe they feel super stiff when you first get out of bed? Do you ever hear a little click or a grinding sound when you move? Well, if any of that sounds familiar, you're in the right place. To really get what's going wrong in osteoarthritis, we first have to peek inside a healthy knee, because it all comes down to this one crucial part, the knee's vital cushion. And what is that cushion? Well, it's called articular cartilage. Just picture this smooth, slippery tissue that caps the ends of your bones. Its job is absolutely essential. It's a shock absorber, and it lets your bones glide past each other without any friction. It's the reason movement is supposed to be painless. And here, you can really see the difference side by side. On the left, that's healthy cartilage. It's thick, it's smooth, it's doing its job. But on the right, that's what happens with osteoarthritis. That cartilage gets worn down, thin, and rough. It can't cushion anymore, and you start to get that awful bone-on-bone friction. And that is exactly where the pain and inflammation come from. Okay, so now we know what's happening on a mechanical level inside the joint. But let's talk about what that actually feels like, the warning signs, and who is most at risk for this. Of course, the number one symptom is pain, especially pain that gets worse the more you do. But there's also that morning stiffness, when it takes a while to get going. You might see some swelling or notice you can't quite bend or straighten your knee like you used to. And another big one is that feeling of instability, where it almost feels like your knee could just give out from under you. Remember that grinding sound we mentioned? It actually has a medical name, crepitation. And I think this quote just nails the description. A lot of patients say it feels like there's sand inside the joint. You can just imagine that gritty, bone-on-bone feeling, can't you? So how common is this, really? Well, take a look at this number. It's estimated that a staggering 70 to 80% of people over the age of 60 are affected by osteoarthritis. That's not a small number. That's the vast majority of people. So what puts someone in that high-risk category? Well, age is definitely the number one factor. It's also about twice as common in women, especially after 50. But other things play a huge part too. Things like carrying extra weight, having an old knee injury, working a physically demanding job, or even just your family history, it all adds up. Okay, so let's say you're listening to this and it's all sounding a little too familiar. So what happens next? How does a doctor officially figure out if it's knee osteoarthritis? Let's walk through it. It's actually a really logical three-step process. First, your doctor's just going to talk to you, get a detailed history of your symptoms and risk factors. Next comes a physical exam, where they'll actually check out your knee, see how it moves, and test its stability. And then the final step to confirm it all is imaging. And when we talk about imaging, X-rays are the real workhorse here. They're the most important tool. Now, here's a cool fact. The X-ray can't actually see the cartilage itself, but what it can see is the space between the bones. And when that space starts to narrow, well, that's the telltale sign that your cushion is wearing thin. All right, now for the most important part of all of this, the treatment roadmap. Because here's the great news. There are so many effective things you can do to manage the symptoms and get your quality of life back. I find the best way to think about treatment is like a pyramid. You don't jump to the most extreme option first. You start at the wide base with the most conservative, simple methods, and you only move up to the next level if you need to. So, what's at the base of this pyramid? It all starts with lifestyle changes, and the impact here can be huge. For example, did you know that losing just 1 pound of body weight takes 4 pounds of pressure off your knees with every step? That's incredible. Physical therapy is also a game changer for building up the muscles around the joint, which acts like a natural knee brace. Now, if those foundational steps aren't quite getting the job done, we move up to level 2. This is where medications and injections come in. We're talking about things like anti-inflammatories to help with pain and swelling, or injections, like corticosteroids for quick relief, or hyaluronic acid, which basically helps lubricate the joint. And finally, at the very top of the pyramid, we have surgical options. These are really for the more advanced cases, where nothing else has worked. It could be something minimally invasive like an arthroscopy to clean up the joint, or an osteotomy to realign the knee. And of course, the final option is a total knee replacement, where they replace the damaged joint with a new one. But you know what's even better than treatment? prevention. So let's take a step back and talk about something really powerful, how you can protect your knees right now to avoid these problems down the road. And the good news is the keys to prevention are actually pretty straightforward and incredibly effective. Keeping a healthy weight is probably the single best thing you can do. Regular, low-impact exercise, think swimming or cycling, is fantastic. Building up those supporting muscles, especially your quads, gives your knee a natural support system. And it goes without saying, if you do injure your knee, get it treated properly. So, I'll leave you with this final thought. After everything we've talked about today, from the causes to the solutions, I want you to ask yourself, what is one simple change you can make, starting right now, to give yourself healthier knees tomorrow? Thanks for tuning in.